This video is on top things that support IC healing. This is a collection of things that I've researched over the years, and I wanted to put it together in a nice video for you to have as a tool as you explore different things that you may be able to utilize to help you with IC healing. A quick disclaimer here. All right, the first one is L-arginine. L-arginine is a precursor for nitric oxide. This plays a role in the relaxation of the smooth muscle of the urinary tract. One study found that nitric oxide synthase, which is an enzyme responsible for synthesizing nitric oxide, is low in people with IC. But then there was another study that found that nitric oxide concentrations are high in people with IC. So there are some conflicting results. Now I have some data here. I don't want to go over all of them with you, but in general, we have found that about 500 milligrams of L-arginine taken 3 times a day has been able to reduce, after 6 months, with baseline pain levels and pain on urination by about 85%, but then also 70% abdominal pain reduction, 67% urethral pain reduction, and decreases in frequency, daytime frequency from 13 to 8, and nighttime frequency from 5 to 2. So that's a pretty significant drop in numbers. So it's worth a try. The recommended dose is about 500 milligrams 3 times a day. A couple things to keep in mind. There's different subtypes where some people will respond favorably and others will respond poorly. So like when people say, what kind of supplements should I take? This is one of those where I'm like, I don't know how you're going to respond. So it's worth a try. Maybe get a smaller bottle of it, or maybe you can, borrow from somebody if you know somebody who has arginine and try it for a few days. I never like to make a decision based off of one day of using it because it could be something else that's bothering you, and we always tend to blame the new thing that we added. You got to be on it for at least 3 to 5 days, and if it's consistently bothering you, then it's probably not going to work. And you also have to give it time to work. If you notice, these studies are all saying 6 months people have been on them before they collected any data. So remember, you can't just go by, a couple trials here and there. You got to be on it for enough time for you to be able to correlate with changes in your symptoms. But anyway, you can try L-arginine. And the one good thing about L-arginine is it also increases your blood flow, which is important for getting more blood and nutrients delivered to the rest of your cells and body. So these are food sources you can get L-arginine from: turkey, pumpkin seeds, spirulina, pork loin, chickpeas, and lentils. All right, quercetin. All right, quercetin is a flavonoid, and it is able to scavenge free radicals, which is really good for reducing oxidative stress in the body, which is tissue damaging. You don't want high levels of oxidative stress and free radicals. They damage your tissues. It also supports vitamin C absorption, which is great for your immune system. It also is mast cell stabilizing. So some of you understand the mast cell involvement in IC, and some of you may have noticed histamine intolerance perhaps, or have mast cell activation syndrome or disorder. Any of those categories is involving this mast cell stabilizing mast cell activity. And this involves some inflammatory cytokines, and so quercetin is known to inhibit some of those processes. A high concentration of activated mast cells are often found in bladder of patients with IC, and this flavonoid, it can inhibit the activity of the mast cells, but it also has anti-inflammatory properties. They did a study of 22 patients, and they did 500 milligrams of quercetin, but this also had other things in it, other enzymes in it as well, like bromelain, papain, and other natural substances, and the symptom index improved by 62%. The problem index improved by 55, and the global assessment improved by 57%. Those are pretty good numbers. Now, you can also get one that has the glycosaminoglycans in there, and there's a product called Cystoprotec that's out there that consists of quercetin with other things, including these glycosaminoglycans. And it has been shown to help rebuild the bladder lining, similar to what Elmeron is supposed to be doing, although that seems a little questionable if you ask me. So quercetin and the glycosaminoglycans in cystoprotag could, because it's made up of the same structure your bladder lining is made up of, could help rebuild the lining, and it's worth a try. Food sources include leafy veggies, broccoli, red onions, peppers, apples, grapes, black tea, green tea, red wine, and some fruit juice. Careful with some of those. Don't want to take stuff that would flare you up, but those are foods high in quercetin. Next is magnesium. Now, we are very deficient in magnesium because of processed foods like whole wheat or brown rice and bleached and white rice flour. All these things, because 75% of the magnesium is lost in it. So also, if you drink a lot of soft drinks, especially like you like the Perrier and the Waterloos that I like, you're also causing magnesium depletion in the body. Alcohol does as well, so does stress and a high-fat diet. So for the most part, we are a magnesium deficient society. Even my children are. I've noticed that with my kids. My daughter had a tick when she was younger, and I started giving her magnesium, and lo and behold, the tick went away. So yes, we are magnesium deficient. It's something that you really can't test for because you really want to check intracellular levels, and your serum levels aren't going to tell you anything about what's going on inside your cell. Now, you could do a hair mineral analysis, which I do run. So that is an option if you want to check to see. You can do a micronutrient test that's intracellular that I also run. Or you can just supplement magnesium. I mean, it might be simple as that. So what are the symptoms of deficiency? Irritability, anxiety, agitation, panic attacks, insomnia, constipation. Okay, so what I thought was interesting, there was a statement that says if you eat a balanced diet, you can't be deficient in magnesium, and that is far from the truth. In fact, with the standard American diet, which is mostly processed, 25 to 75% of the original nutrients in food has been lost. And American diet has less than 80% of the RDA of calcium, magnesium, iron, zinc, copper, and manganese. So something to be said about that. That's why we like to supplement to help replete some of that. You just can't get enough from food. Plus, we have such stress and things that deplete us. So, magnesium is something that's really simple to supplement with. So, I wanted to mention that the best test is a loading test. And so you can basically load up on magnesium until you get to bowel tolerance. And what that means is you slowly increase the dose until you have loose stools. You mark down how much it took to get loose stools. So let's say you took 1 gram and you didn't have loose stools. Then you took 2 grams, you didn't have loose stools. And then you went all the way up to 5 grams and you started to have loose stools. That's your bowel tolerance. Then you're going to take 25% of that. Right? So, and then you're going to make that your new dose. And so let's say you did 25% of 5 and you drop it down to 4 or something grams, and then you maintain that, and then you start to get loose stool on that dose, then you're going to drop another 25%. And you're kind of loading up on the magnesium and replenishing your stores that way. And eventually you can just go back down to a regular dose. So typically most people supplement with 260 to 380 milligrams of magnesium per day. And that seems to be sufficient for relieving the symptoms of interstitial cystitis and bladder spasms. Because it's a muscle relaxer, it can also inhibit the release of acetylcholine at the synapse. So when a nerve is being overstimulated, magnesium can calm it down. And I see a lot of times the nerves are being overstimulated. So this can be a really good way to calm down that overstimulation. All right, so what form of magnesium? Oh, these are food sources of magnesium. Dark chocolate, avocados, almonds, cashews, Brazil nuts, legumes, lentils, chickpeas, tofu, flax seeds, pumpkin seeds, and chia seeds. So if you just eat those, you can get lots of magnesium and then you won't have to supplement as much. All right, so which form of magnesium? I wanted to know so many different forms, and it's just hard to know, which form of magnesium is best for you. So here's a little summary. Magnesium oxide is usually used for acid reflux and heartburn. It can also be used as a laxative. Magnesium citrate is typically used for people who have constipation and motility issues. It can also prevent kidney stones and helps with oxalates. So if you have an oxalate issue associated with your IC, magnesium citrate might be the best bet for you. You get 2 for 1. You get a little muscle relaxing, and you also get the ability to bind the oxalates. Hey, that's a great combination if you ask me. I use magnesium citrate. Actually, I have a powdered magnesium that I use that has all three different forms: magnesium malate, citrate, and a third one which I can't. Oh, glycinate. Yeah, that has those three. But you can just get regular mag citrate. You can get magnesium calm, and that will bind to your oxalates and help with digestion and constipation, and also muscle relaxing. It's a little bit more bioavailable than magnesium oxide. So magnesium oxide is probably the worst one. Then there's magnesium orotate, which they're saying is the most effective, and it has the highest bioavailability. So you might want to look at that one. It comes with, let's see, magnesium orotate dihydrate is the most effective form of magnesium and helpful for addressing deficiencies. Has both magnesium and orotic acid. And it shows that orotates can penetrate cell membranes, enabling effective delivery of the magnesium to the innermost layers of your mitochondria. So this will help with the mitochondrial dysfunction. This is important in heart and nerve cells, which are unable to renew or regenerate when damaged, and it is going to help deliver magnesium to recover these tissues. It is a favorite amongst athletes because it has the ability to repair tissue, enhance stamina, and performance. So magnesium orotate. So if you feel stressed, so that's for tissue recovery. Now for the next one, which is let me skip over to magnesium glycinate. That one is really good for when you're stressed. So orotate is the most effective and great for tissue recovery. Glycinate is good for relaxation, sleep quality, and stress relief. So if you feel stressed, that might be a good one for you. It also supports muscle relaxation, so that could help with the bladder as well. And then finally, there's magnesium malate. That one is good for energy and fatigue and mitochondrial. In fact, it's part of the Cowden protocol with Lyme is magnesium malate. That's one of the ones that they use because a lot of people with Lyme have chronic fatigue. Malate is actually naturally found in apples, malic acid. Interestingly, I've kind of noticed that apples help with energy. So, malate, magnesium malate, great combination. So that's why I use the one that has three different forms, because then I'm hitting all three. I have glycinate, malate, and I have citrate. But you want to pick one for a specific purpose, you can. Now, I want to show you about magnesium threonate. That's a new one that I learned about and started giving to my daughter. This one is the up-and-coming magnesium for the brain. So if you have issues with neuroinflammation or excitotoxicity or inability to sleep or mood problems or stress issues, this might be the one for you. I started doing this to my daughter because I started noticing some mood swings, and I thought, hey, let's support her brain. And I've noticed a change in her. She's a little bit calmer. So it is the latest magnesium form that people are looking at. It was developed by a team of neuroscientists at Massachusetts Institute of Technology, and they bound magnesium threonate, which is a vitamin C metabolite. The great thing about this, it can cross the blood-brain barrier of your brain, so it can actually get right into the brain, and it can increase brain plasticity. It can help with the ability of the brain to change and to grow, and it's good for memory and learning. It is, there's not a lot of clinical trials with it yet. There's only one so far, peer-reviewed, but there is some evidence that it can increase BDNF, brain-derived neurotropic factor, which is a protein that stimulates new brain cells. So it can help you increase brain cells. Let's see what else. It'll help with memory, learning, attention, setting goals. Also, it's been shown to help with anxiety. It's a natural relaxant. It can increase GABA, which is important for stress. So you need to increase GABA if you're having issues relaxing, high anxiety, and difficulty sleeping or staying asleep. Difficulty staying asleep is a GABA problem usually. Let's see, it can help with glucose metabolism, energy production. So I have to say, a lot of people with IC have neurological derived issues. This might be the form of magnesium for you. So I'd love to hear from you if you've tried it, and let me know how it's doing for your overall symptoms and quality of life and moods. All right, moving on, vitamin E. All right, this quick one here, vitamin E is basically can support cell membrane integrity of different cell membranes like your gut, your skin, your arteries. It can stabilize lipid membranes. So the membrane of your cell is made up of fat, and so it can help stabilize that. It can make it more fluid. So that's really good for, overall import and export of nutrients in and out of the cell. You want it to be fluid. You don't want it to be rigid. It can also prevent some of the damage that's induced by oxidative stress and other stressors. There's really not a whole lot of information about this in IC overall. It's a global thing. It's not necessarily going to immediately notice differences taking vitamin. You're not going to be like, my bladder feels better. It's not like that. This is more global, kind of globally addressing the dysfunctions that might be contributing to the pathogenesis of the problem. All right. Food sources: sunflower seeds, almonds, hazelnuts, mango, avocado, butternut squash, broccoli, and kiwi. All right. Desert harvest aloe. So I had to put this one in here because so many people have said it's helped them. It also can preserve the GIG layer, just like we said was in that cystoprotag. It contains ace-mannan, which is found in the aloe. It's a polysaccharide of mannose molecules, which is supportive of the bladder as well and can help prevent urinary tract infections. And I would go as far as to say if you have a biofilm that's in your IC is caused by a biofilm or a subepithelial biofilm, this might actually help when the biofilm sheds, having the mannose in there to attach to the bacteria that come out. Because bacteria tend to stick to the sugar instead of the bladder wall. That's the theory. And then they can leave through your urine. Let's see what else. They're saying that you have to start with 6 capsules a day, 3 twice a day, and you can increase up to 12. And that's the only downside of this product is the dosing is a little bit on the higher side. But if you look at this chart over here, I mean, you can't beat these results. This is really awesome. Reduction in, urinary frequency, pelvic pain, burning, with this product. So 92% relief with IC is what people have said. Now here's some other statistics I got from the website. This is a 2016 survey with 660 people using. 92% reported self-reported that they experienced relief with concentrated oral aloe vera. 63% reported substantial improvement in urgency and frequency. 69% reported substantial improvement in pelvic pain, and 68% in urethral burning. So great results there. All right, Stockton aloe. I've seen this before, so let me just go ahead and go through this. Stimulates your immune system, protects your gut from fungus, bacteria like H. pylori and viruses. It can inhibit cancer growth, can improve inflammation in your GI tract. It's also high in ace-mannan, the real stuff. It can stimulate your immune system. It's antiviral, anti-cancer, contains these nice components. I'm not even going to try to pronounce that word. Fatty acids, enzymes, vitamins, and minerals, and it is a superfood. I can definitely show you where to order this. This is great stuff. It's really helped me tremendously. It's great for your gut. If you have any gut inflammation, this is going to coat it and really help you with pain. Long-term, the ace-mannan is going to help your immune system. I buy them in 8 packs at a time, and then I freeze them in my freezer. It's just cheaper that way with the shipping and everything. You go and get the 8, freeze it in your freezer. I started with doing 2 to 3 cups a day initially. I was on a lot of them because I was having some hemorrhaging from my bladder. I was bleeding. I needed to get that stopped. So I was doing 3 cups, and then I backed off and did 1 cup a day, and now I'm skipping weeks. I'm taking it once every other week, 1 cup. So like I just defrosted mine today, and I'm going to be doing it this week. So good stuff. All right, CBG. All right, so this is this particular one has more than CBG in it, by the way. This also has terpenes and other components. So when people ask me about Recept, this brand is not just CBG. There's other things in it that's also healing. Okay, so if you have any questions or want to know more about it, let me know. I can definitely hook you up. And this stuff has been very, very good for people who've already started using it and told me that it's helped them get up less frequently in the middle of the night, help them with pain, help them with inflammation, and help them with bladder infections. So great product. Also helps with anxiety. It has antibacterial agents, anti-cancer, anti-inflammatory. I think I already said that. Now, for some people, it can be an appetite stimulant, which is actually a lot of us, not me, but you guys. A lot of you guys are underweight, and so this is going to help increase your appetite so that you can eat better. It can be helpful in bladder contractions because it can inhibit the acetylcholine receptors. So, and here's a study that showed that CBG is an effective antibacterial agent against Staph aureus, which people have have in their bladders, believe it or not. It's a strain that's resistant to several classes of drugs. So topical formulations have been used in skin infections. And it's also been able to inhibit the growth of colorectal cancer cells. So it interacts both with CB1 and CB2 receptors. So it's going to really help with mood, sleep, and appetite. All right, and then there's the anti-inflammatory drink. Some of you have seen this. This is my signature drink. Whenever I'm feeling I'm going to get inflamed, or if I come back from a restaurant, I'm not sure what was in the food, I'll go ahead and make this. It's got ginger, which is a really big piece, golden milk here, turmeric, which is here, and here, curcumin and resveratrol, manuka honey. So it's all overall really good stuff for the gut, for inflammation, for overall health, and it's actually not bad. I also added some collagen to this too, from Perfect Keto, vanilla collagen, which is really delicious. And I can hook you up with that one too. Makes it really creamy. And then omega-3 is important for quenching inflammation. It cannot be underestimated. There's actually true physiological biochemical processes going on that goes in, and I don't want to get into the science, but I've seen it, I believe it, I know it, I've seen it myself. You have to take a therapeutic dose. That's the only caveat. You can't just take 2 pills and think it's going to be enough. You've got to take about 3 to 5 grams total of omegas. Okay, so you need, for inflammation, you're going to need a higher ratio, a 3-to-1 ratio of the EPA to DHA. So you got to turn the bottle around and take a look and see, is the EPA greater than the DHA? That is going to be for your inflammation. You need more. You need a 3-to-1 ratio. Now, if you want it for brain health, then you're going to need more DHA. So if you were trying to address both, I would get a bottle of the EPA DHA and take, I like the Metagenics because it's pretty high. I do like 2 full teaspoons of it. And if I'm feeling inflamed, I double it. And then if I want brain, like for children, for example, you want them more of the DHA for kids because that helps with their brain and with brain health and learning memory and all that other stuff. So, yeah. So don't underestimate omegas. It is not, overrated. It is definitely something that you need to do. And then if you're a vegetarian, you can get them from these foods here, but honestly, they're not as bioavailable as the non-vegetarian sources. So I would highly recommend fish oil, cod liver oil. You can do algae oil also, but again, not the same level of bioavailability. And here's a slide that shows you what happens. So I told you there's a little bit of biology behind it, and I don't want to get into detail, but balancing the ratio of 6 and 3 is very important. And fish oil comes in here, okay, and helps resolve some of these inflammatory mediators here, okay? So it helps to resolve some of the inflammation. So you have the inflammation here, and then you've got resolution. So how does this inflammation get resolved? How do you go from inflamed to not inflamed? Well, this is where the EPA and the DHA come into play. All right, so how do you know? So that's just proof, okay? I don't want to get into it. I just want to give you proof that this is all science-based. I'm not making this stuff up. Everything I say is based on science, okay? And there it is. There's the image. It shows you what I'm talking about. I'm not, just talking for fun. I back up what I say with science. It's a lot of information, but remember, I'm the one who's researching it and I'm delivering it to you. So signs of omega-3 include excessive thirst, frequent urination, dry hair, dry skin. Okay, so if you have any of that stuff, pain, give it a try. It can't hurt.